Risk is a part of life. Calculating our exposure to risk is something we do all the time. There are 160,000 motor vehicle accidents in Canada every year, and around 2,800 Canadians die in them. In addition to these 2,800 annual deaths, an even larger number of people will suffer other harms, ranging from minor injuries through to brain damage and quadriplegia. These 2,800 car accident deaths are distributed amongst all age brackets. Roughly 4/5 of victims are under the age of 70. Yet, every day, millions of Canadians get into their cars as drivers or as passengers. We should treat COVID with the same careful risk assessment that we apply to our driving habits. In 2020, more than 309,000 Canadians died, a death rate consistent with 2019, 2018, 2017, and prior years. Of these 309,000 deaths, only about 5% were linked to COVID. The vast majority of people dying with COVID are over the age of 82, which is the average life expectancy for Canadians. Government data tells us that COVID has a negligible impact on life expectancy. The infection survival rate from COVID is 99.77%. Lockdown restrictions are based on the belief that COVID can be passed along by healthy people who show no symptoms. The Justice Centre has asked Canada's federal and provincial health ministers to provide the science that backs up the government's belief in asymptomatic spread, and we receive no answers, no medical reports, no scientific studies, because the belief in asymptomatic spread is not backed up by science. COVID does not spread amongst healthy people or by casual contact. The so-called cases reported on by our sensationalist media do not refer to sick people, but to people who tested positive on a PCR test, which does not diagnose COVID. The accuracy of the PCR test has been questioned repeatedly and publicly by infectious disease specialists and other medical experts. But panic porn sells papers and gets people to watch the 6 o'clock news. Do not expect media to stop reporting on meaningless case numbers anytime soon. The government's own statistics tell us that COVID simply isn't the unusually deadly killer that politicians make it out to be. The government's own numbers do not justify ongoing restrictions of our charter freedoms, or the obvious lockdown harms, or the continued fear-mongering by media. Among Canadians under the age of 70, car accidents pose a higher risk of death than COVID does. I'm John Carpe. Thanks for listening.